Welcome to the Cancer Interviews Podcast, where we are sharing the cancer journey together through interviews with ordinary people whose lives have somehow been impacted by cancer. And now today's host, former prostate cancer patient who underwent successful brachytherapy treatment, also known as SEEDS, and very grateful cancer survivor, Bruce Morton.
Greetings and welcome to the Cancer Interviews Podcast. I'm your host, Bruce Morton. No cancer journey is easy, but some are tougher than others, and some of the most difficult cancer journeys can be tied to ovarian cancer. Our guest on this segment is Lexi Mestas of Mobile, Alabama, a survivor of ovarian cancer. So now let's hear her story. And Lexi, welcome to Cancer Interviews.
Thank you for having me.
Now, Lexi, we like to start out from pretty much the same place with all of our interviews, and that's to find out a little bit more about you, exclusive of your cancer journey. So if you would, tell us a little bit about where you're from and what you like to do for work, and when time allows, what you like to do for fun.
Sure. So I am originally from Biloxi, Mississippi. Pre-Katrina, post-Katrina, I moved with my family to Mobile, Alabama. And from there, I went to school in New Orleans, where I studied political science and Middle East peace studies with a focus in food diplomacy. And then I went to grad school in Rome, Italy, at the American University of Rome, studying food studies, social science-based. And from there, I went to Philadelphia, where I worked in Camden, New Jersey for SNAP education, doing nutrition education and specializing in urban food access. And then I was diagnosed in February 2021, and my focus is still in public health, but has changed a little bit to more of the ovarian cancer world and low-grade serous specifically. And for fun, I love to spend time with my dog, who I adopted during my diagnosis and treatment and recovery. Spending time with my husband and my family, and I very much enjoy cooking and eating.
For those of us who don't know, what is food diplomacy?
So the idea behind food diplomacy, and I focused specifically on the relationship between Iran and the United States, and how the relationship between the populaces is different than that between the governments. And this idea of culture sharing, food culture sharing, could break down some boundaries or barriers that we typically face in just not knowing much about each other, and so that we can build a healthier, more sustainable relationship.
Does food diplomacy have anything, is it related in any sort of way with the term food insecurity?
It's not, but I have spent most of my career working in food insecurity, SNAP education. So SNAP, the Supplemental Nutrition Assistance Program, has an education piece. We aimed to try and help people who were SNAP eligible maximize their health, as well as maximizing their benefits.
As for your cancer journey, what preceded it? When did you notice that from a health perspective for yourself that something was a bit amiss, something was a bit unusual, something might be wrong?
So I had actually had symptoms for about 8 years before my diagnosis. Ovarian cancer mimics IBS in a lot of ways, and low-grade serous can start as what's called borderline. And it has never been confirmed if that's what I've had, but I had the implants on my ovaries in that same fashion that someone with a borderline ovarian syndrome may have, which is a pre-cancer, if you will. And so I started experiencing these symptoms when I was about 17, 18. And it was a lot of abdominal discomfort. I had very heavy menstrual cycles, and so it ended up being on birth control early. And I had intense breakouts and just a lot of overly active estrogen and weight gain and things like that. And so I saw many different doctors. I saw GI doctors, I saw gynecologists, and the decision was to just simply put me on birth control and say that it's IBS, and just kind of be okay with me living with a level of pain. But in February of 2021, the pain became just so unbearable that I was vomiting uncontrollably and had to go to the emergency room.
And before we go any farther, just to define terms, IDS stands for?
IBS, irritable bowel syndrome.
Okay, and there was a tipping point in which you decided to be you decided to be seen, albeit at a different level. And if you would describe the chain of events that came after that.
Sure. So I'd had a couple of really intense episodes of pain, color from my face, just an extreme kind of pain in my stomach. And I met virtually, this is during the pandemic, the height of the pandemic, with my doctor, my GI doctor, who said, it sounds like you're constipated, take a Fleet's enema, and that did not work. So I just, I felt like I wasn't being listened to. And then it happened again, a couple of months later. And this was a different kind of pain. It was that same color from my face, stomach pain, very, very uncomfortable, lower left. But this time it was accompanied with vomiting, and I just couldn't control it. It was a very intense kind of pain. And my husband called the nearest hospitals and asked what the wait time was in the emergency room. I put on a garbage bag or trash bag around my ears just so we could make it in the car. And we ended up going to Jefferson Hospital in Philadelphia, where I was living at the time. And I went in convinced that I had something going on with my bowels, because I had been told for so long that I had IBS, irritable bowel syndrome. And they took one listen to my bowels and said, it's not your bowels. Your bowels, they're moving fine. So we have to figure out what is going on. So I went through a very chaotic, about 24 hours of them putting me through different transvaginal ultrasounds and x-rays and all of these different things for them to finally see that I had a cyst on my ovary, my left ovary, that was so large that they actually could not see the ovary anymore. And they were convinced that my ovary was twisted, which was causing the pain. So we had emergency surgery. And I recovered very quickly, was up and walking within a few hours, but they did tell me that they saw 9 total cysts, 3 on my left ovary alone, the size of my hand, and that they saw a few abnormal looking markings on my abdominal wall, just very microscopic, but that they thought it was endometriosis, but they decided to just send it off to pathology just in case. And this is February 9th of this year. And on February 15th, the day after Valentine's Day, the surgeon who was in the emergency room that day, and my primary care doctor called me to tell me that it was cancer, that we didn't actually know if it was ovarian cancer. It seemed to be that way based off of what they could see, but the amount that they had sent to pathology was so small that they couldn't quite confirm what exactly it was. So we knew that we needed to take further steps. And from there, I had an exploratory lap, and a lot more came to follow.
I am guessing that over the course of the years that preceded this, you had done some research and you had gone through these complications. As horrific as this news was, did everything you had gone through to some degree prepare you for this horrific news?
I don't think anybody can really be prepared for the word cancer. That is just very heavy on so many levels. What you feel is, I think, yes, a sense of relief to an extent of like, okay, now I know what's been causing my pain. I don't have to be in pain anymore. But at the same time, you feel that sadness, the anger, the frustration, the anxiety. There's very intense fear, especially with the kind of diagnosis that I received. And so, I felt a little bit of relief in that I felt better immediately after my debulking surgery. Most people really struggle through chemo. I did not. I worked out, I exercised, I maintained my healthy diet. So I felt good, but it doesn't take away from that sense of dread and fear that cancer can bring.
And what is exactly the name of your particular diagnosis?
So I was diagnosed with low-grade serous ovarian cancer. It's an epithelial cancer, which means that it grows on your tissues. And low grade is different from the more commonly high grade, which grows more aggressively and like large tumors. Low grade grows, it's been described to me almost as growing like sandpaper on your tissues. It's very tiny, small tumors. And the reason why it's so challenging, and of course, all ovarian cancer is challenging because it does mimic IBS and different GI-related diagnoses, is because of that. It's caught typically stage 3 and 4. So it leaves you to kind of fight this later in the game, and it leads to more complications and challenges than an early diagnosis. But yeah, it is. It's tough because these cells are abnormal enough to be cancerous, but they're not abnormal enough to be responsive to chemotherapy. So typically chemo or low-grade serous patients are not responsive to chemo, and we treat it as a chronic disease that we will kind of live with forever and cycle through different treatments and therapies. So it is a scary diagnosis to have, but even more so in relation to the funding that we receive and the hope that we want to have for some sort of a cure or a treatment that works for all of us and works more than for just a few years. The average lifespan is 10 to 12 years for someone who's diagnosed with low-grade serous, and the majority of us are in our 20s and 30s, which is very sad for us. And we only receive 1% of all funding for ovarian cancer research. So we rely very heavily on private funding, which is why we've leaned on organizations like Cure Our Ovarian Cancer, which is just so incredible.
And I want to get to Cure Our Ovarian Cancer just a little bit later, but you had referenced treatments and therapies. If you would, describe those treatments and therapies.
Sure, there are many. The most important one is your surgery, your debulking surgery, where your doctor will help you remove all visible cancer. For most of us, because it is diagnosed at stages 3 and 4, that means a full hysterectomy, appendectomy, splenectomy. I've personally had my spleen removed, scraping of the omentum and my bladder flap. It's quite an extensive surgery, and it takes a long time to recover from that. And then it's typically followed up with 6 cycles of platinum-based chemotherapy by IV over the course of 18 weeks. And from there, the protocol right now is to put patients on a hormone blocker because most of our tumors are estrogen positive. Mine is 90% estrogen positive, so they put you on Letrozole hormone blocker. And right now, I actually just received a second opinion last week from MD Anderson, and it may be determined within the next few days that my the Letrozole has not worked for me, and I may be experiencing my first recurrence. And the next treatment option available for me is called Trametinib, which is typically given to those with melanoma. It's off-label, being used for ovarian cancer, but Dr. Gershenson at MD Anderson's research has shown that it's significant enough, its impact is significant enough that it should be considered the standard of care. That is what I can speak to now, but there are various different opportunities for treatment, like Avastin and other IV treatments that are platinum-based as well for follow-up. But it's very common, 95 upwards % of low-grade serous patients will experience a recurrence.
By the way, if you like what you hear in this segment, we invite you to subscribe to our podcast by checking the links below. Once there, you will see a bell icon. If you click on that, we will notify you when we post a new interview. Lexi, now we get to the aftercare phase, and who would you say that during your aftercare was your biggest source of support?
For a person personally in my life, my aunt, she's the only person in my family who has been ever diagnosed with cancer, and she had stage 1 breast cancer, but she also is a lifelong oncology nurse. So she was an incredible source of information, as well as that love and care that you receive from a family member. My husband has been incredible, my parents, but as far as resources, I had two that were really wonderful. One, not so much related to ovarian cancer specifically, but it's a program called Unite for Her for anyone that's in the greater Philadelphia area. If you have been diagnosed with breast or ovarian cancer, you can sign up to receive a gift package as well as a passport that will allow you to partake in free services. I spent all of mine on acupuncture, and it was very helpful for me. But also, Cure Our Ovarian Cancer is the leading low-grade serous organization in the world, led by Jane. She's just fabulous and very inspirational. But their website really provides just great detail about what low-grade serous is, the research that's being done, research that they are supporting, doctors who they have brought together in this consortium, and really help to provide a lot of hope and connect you with a lot of different people with ovaries who are going through what you're going through. For me, most notably, the Facebook group page has just been a great way to stay in touch with people who are going through what you're going through. It can feel very isolating to have cancer, let alone a rare subtype like this, and to be young and going through this. So it's a great resource, and it's an organization that's doing wildly impactful work.
And its web address is, and this is all one word, cureourovariancancer.org. Again, all one word, cureourovariancancer.org. Now, getting back to your aftercare, Lexi, what would you say was the toughest part? I can't imagine chemo would be easy because it's not easy for anybody, but was that the toughest part, or was something else even tougher?
No, I actually had a fairly easy time with chemo. I think I had a tough time when it came to the steroids and sleeping for a few days. but I didn't have the typical symptoms that most people have, like nausea, vomiting, bone cramps, or neuropathy. I didn't really have any of it. Didn't lose my appetite, so I was able to maintain exercising. I think so much for me of what the hardest thing has been is trying to live and think beyond the fear, not letting the fear be present in my life every day, and trying to find some sort of normalcy. I did not know what I was going to need after treatment. I don't think anybody who's going through it for the first time does. And so I made the decision to make quite a large cross-country move to be near family. And while that has been great for me, the cultural shock has been a lot. And I treated myself a little bit like I was dying, I think, in a way, rather than seeing the other side as an opportunity to live. And so I feel like I'm 28 and I'm retired a little bit in this kind of sleepy town. So I'm kind of chomping at the bit to get back to living and I don't know, make a change or whatever. But I honestly think that the mental struggle has been harder than any of the physical.
And is there anyone, your aunt, your husband, who can help you with that piece, or is that something that you can only do yourself?
You know, I think there's an element of it that feels like there are pieces of it where you feel like you could only do it yourself, and that I am the only person I immediately know who has this kind of cancer and is going through it so young. I feel very odd man out when it comes to my sisters. I have 3 sisters, and you know, everybody else can have babies and do all of the things I can't, and that is sad. But I think there are ways to kind of get past that feeling alone and isolated. And my aunt, having gone through her own cancer journey, is incredibly helpful. But leaning on the support from the Facebook group and knowing that I'm not alone, and these people are experiencing what I'm experiencing. And so many of them are well into their journey. They've defied the odds and are past that 10 or 12 years, and they have a lot of insight and support. Some of them, at the drop of a hat, will take my call and be ready to talk to me and encourage me and let me know that a number is a number. I'm not a number, and there's a lot of life to live, which is incredibly just priceless when you're in this kind of situation.
It sounds like the people from the Facebook group have been a great deal of inspiration.
Absolutely, absolutely.
You've talked about some of the things you can't do, but you had mentioned that exercise has been a part of your life. In terms of exercise or other things, what were you able to do pre-diagnosis that you can still do now, which in a way may be a source of inspiration for others?
Sure. So during treatment and now, I exercise daily. I've done different kinds of yoga and pelvic floor exercises. I love to get on my rebounder and do different bounce routines on the trampoline. And right now I am training for a 10K. So I'm very excited about that. It's on my life list, running a race. And so I've been able to maintain exercise, and that feels very good for me. That I don't feel that my body has changed much. I feel like a lot of my issues have been resolved actually with my cancer treatment. And I feel like I can continue doing those things. And that's been a good constant for me. But I think even more so, I was leading a county program, and my career has been very social justice driven in the public health world. And I'm very type A, and I'm also very action based. And so, with a diagnosis that feels very out of control, and I feel like I don't have much control over it other than maintaining a good baseline health and trying to be positive and exercise. I found a lot of peace, and I still do, in fundraising for low-grade serous and advocating and trying to raise awareness. So I took part in a number of different, I worked with ACS Pennsylvania to speak with the Cancer Caucus, the Congressional Cancer Caucus, about raising research funding. I made media appearances in Philadelphia. I've done a number of different podcasts and interviews on my own Instagram, which I'm very active. I've spoken out and provided people with resources and access to my own story through writing a blog on Substack. And I've fundraised quite a bit. I actually just hit 50,000 since March 21st, and I'm feeling very proud of that and very excited. But it gives me, it makes me feel like there's some way to be active in the solution. Whereas when I was first diagnosed, I just felt so lost. So finding that has really provided me a lot of direction.
Our guest is Lexi Mestas of Mobile, Alabama, and Lexi, we're gonna start wrapping up now. And whereas we kind of start from the same place with each one of our interviews, we kind of end at the same place, and we end with this question: if you found yourself speaking one-on-one with someone who had just been diagnosed with low-grade serous carcinoma, and if you had a message for them, if there was one overarching point, what is the one thing you would want to drive home to that person?
Keep pushing for answers until you get the answers that you want. If you feel that you are not being heard and you're not being listened to, it's okay to ask for a second opinion. It's okay to choose a doctor who you feel is providing you the care that you need. And if you are experiencing bloating or frequent urination, changes in your bowel habits, any sort of abdominal pain in combination for more than 2 weeks, ask your doctor for a CA-125 blood test and a transvaginal ultrasound, and really keep being your best advocate.
By the way, when you brought up the things that you said one should request, I'm curious, is it easy to obtain those sorts of screenings? And I say that because one thing I've learned through these interviews, Lexi, is that with different sorts of cancer, there are different levels of degree of difficulty in getting the screenings you need. The things that you mentioned, are those easy to obtain?
Insurance is always a challenge, but I think if you have a family history of ovarian cancer, and if you're experiencing these symptoms and you're being denied access to these, make sure that it's being documented in your chart, and continue to ask and go see other doctors until you are able to get those tests. I did not know that was something I should be asking for. I didn't even know that these were symptoms of ovarian cancer. So the more that you are able to keep pushing and know that pain every day is not normal, the better your outcome will be.
All right, Lexi, thanks so much. Thanks for a lot of great information. And going forward, I certainly wish you the best with your disseminating key information that can be of use to other people, and best wishes with that 10K. Lexi, thanks so much for being with us.
Thank you for having me.
And that's going to wrap up this edition of Cancer Interviews. To echo what Lexi had said, as you go through the cancer journey, you are not alone. So until next time, we'll see you on down the road.